Okay, so the meeting is now being recorded. And we do this just so that we can make whatever content is appropriate to make available later after the fact on our website, so that it's a resource for you to come back to if you want to revisit it, or for anyone who might have missed the session. And I'm just going to quickly go over how to use WebEx in case anyone's unfamiliar, and then I'll turn it over to Carolyn. So the first thing is that you can turn on your closed captioning if you'd like to do that by clicking the CC button at the bottom left-hand corner of your screen. You can also change the layout of what you're seeing using the layout button at the top right-hand corner of your screen. You can raise your hand or do a thumbs up by clicking either the hand or the smiley face buttons at the bottom center of your screen. But please note that in this format of WebEx, you can't actually unmute yourself. So if you do have a question that you'd like to speak out loud, you can just raise your hand and I'll be keeping an eye on the participant list, and I can unmute you if you'd like to do that. Otherwise, you can type your questions in the chat. Carolyn has been kind enough to agree that if there's a question that she can address throughout the session, she'll do so. But there will also be time for questions at the end. So I'm going to stop sharing my screen now, and I'll turn it over to you, Carolyn.
Wonderful. Thank you so much, Chelsea, for the introduction, and thank you everyone for joining us today. I'm just going to pull up my PowerPoint. Oops, sorry. Bear with me a moment. There we go. Wonderful. So thanks so much, Chelsea, for the introduction, and thank you so much everyone for joining me today to talk a little bit about budgeting for meaningful patient engagement in health research. And before we start off, I wanted to acknowledge that I am over here in Manitoba, where we have a big blizzard going on today. It seems like that both of us keep changing our blizzards. So I'd first like to start off by acknowledging that myself and the Center for Healthcare Innovation are located on the ancestral and current day lands and waters of the Anishinaabe, Cree, Ojibwe, Cree, Dakota, and Dene Suline people, and on the national homeland of the Red River Métis. And in northern Manitoba, we acknowledge the ancestral lands of the Inuit and gratefully acknowledge that our water is sourced from Shoal Lake 40 First Nation. And today, and coming together today, we respect the treaties that were made on these lands, and we acknowledge the harms and mistakes of the past, and we recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, childcare, the justice system and government systems. And we dedicate ourselves moving forward in partnership in a spirit of reconciliation and collaboration. And one of the big things I think when we talk about engagement is Indigenous methodologies are at the forefront, and Indigenous scholars and students and researchers and communities we should be looking to. And we also believe that when we talk about patient and public engagement, and you'll hear it throughout the talk today, we really want to make sure that it's grounded in social justice and health equity. So today's session, the learning objectives are, so following this session, we should be able to identify some key considerations when we're budgeting for patient or public engagement. You should be able to access and use our budgeting tool and develop a draft budget that can be attached to funding applications, which is super exciting. And just to ground us, I know most of you have probably seen the definition of the strategy for patient-oriented research. So they define patient-oriented research as this type of continuum of research that encapsulates 5 key components. First of all, it engages patients as partners. So that means people with lived and living experience, caregivers, families, communities, are actively and meaningfully engaged in decision-making about the research process. We're also looking at research that focuses on patient-identified priorities. It works to improve patient outcomes. It's conducted by multidisciplinary teams in partnership with relevant stakeholders. So those could include healthcare, healthcare professionals, healthcare decision makers, so a variety of different stakeholders. And it really aims to apply the knowledge generated to improve healthcare systems in practice. So really going from research to action. And so you might recognize I always capitalize and underline the and that just really means patient-oriented research must include all of these different aspects. And so when we talk about patient engagement, the strategy for patient-oriented research and the Canadian Institutes of Health Research really define patient engagement as the meaningful and active involvement of patients in the governance of research. So you'll see people with lived experience, families, caregivers, communities at the highest level of decision making around research. So in steering committees, operation committees, data safety monitoring boards, actively being involved in those decisions. In the priority setting of research, so research really focuses on what matters most to those living with the health issue or communities that are affected. The conducting of research, so that's when we have patient partner co-researchers who are actively involved not only in the design, but perhaps they're involved in data collection or the interpretation of data. And then the knowledge translation of research, which is just another way of saying getting research into practice. And today, when we're talking about budgeting, we sometimes talk about levels of engagement. And so there's kind of at the lower level, we have the consultation level where we're obtaining feedback and input from people with lived experience, but researchers still maintain a lot of the decision-making power, all the way to collaboration where there's shared decision-making along the way, there's active partnering, and then patient and public directed is oftentimes when people with lived experience, communities, families, actively control, direct, and manage the research process. So that's when researchers are actually, their role kind of is to carry out some of the research. Their expertise is around the research methodologies, but it's under the direction of people with lived and living experience and communities. And so it's always really important to consider this as you're developing your strategy, because it plays out in your budget when you're putting together your budget, because you may choose different types of participatory approaches depending on the level of engagement that you're looking at. And so that's what also we'll see, the participatory approaches can change depending who you're engaging, at what level you're engaging. And so that has to be considered as you start developing your lovely budget for engagement. So considerations to start thinking about as you're developing your engagement and hence then moving towards your budgeting. A lot of times we talk about assessing expectations and willingness to engage. So internally, researchers having that heart-to-heart to have an understanding of the required level of engagement, but how much the team believes that engagement will improve the outcomes, all of the different potential for patients to influence decision-making within the research process. So a lot of times when I talk to people, I'm like, what decisions can people with lived and living experience throughout the research continuum really help inform? Like where can they actively be engaged? And then what is the likelihood that research will fully consider this input? And then what resources are going to be required in order to make sure that it can be inclusive and people can truly contribute to that decision making? And it's really important to talk to people who you want to engage as well. So an external evaluation, having conversations with the people you want to engage, the communities, caregivers, people with lived experience, having an understanding of what previous history of engagement has been. So whether there has been previous engagement that hasn't gone well, whether people have participated before and they really dislike the way engagement, it's really good to help you form your strategy and how you're going to lay out the budget. I always go through this kind of question when you're thinking about who you want to engage, what inequities exist in relation to the health issue that's being researched, who's affected differently, who has different access to services. So not only those geographical barriers, but also thinking about systemic barriers, people who may have experienced racism, colonialism, ableism, transphobia, all of these different things when they've gone to access a service or an intervention, and hence do not have the same type of access as other people do. And how are we going to make sure that we get all of these voices and engage all of these voices, which might mean you might need different types of participatory approaches to reach different groups that you want to engage. And so that is reflected in your budget as well. And then where along the patient journey, this one's an interesting one. So sometimes you're engaging and you get people who are newly diagnosed, you get people who have been living with a health issue for 10, 20 years. And sometimes, just depending when you're talking to people with lived and living experience, you might find that newly diagnosed, they really want to meet together. And so you might want 2 different meetings, just to depending on how people feel comfortable, or whether some people want one-on-one engagement versus group engagement, and so on. And so really having those conversations, you can get an understanding of what the values and expectations of people who you want to engage, what level do people want to be engaged at. So sometimes research teams make assumptions about what level, or they may say, well, we can only engage at a consultation, but people with lived experience come back and say collaborative or bust, like we will only engage if we're at a shared decision point. And so it's really good to have these conversations out front so that you're cognizant of it, and really design your strategy and your budget in that way. And then how would people prefer to engage? We've had projects before where, yeah, some people want one-on-one, some people want meetings. And so that factors into how you design your budget and your strategy. Some of the resources we have we have a readiness to engage workbook, and that actually includes questions for individual researchers and patient partners, and then also questions for team as they get ready to engage. And then we have a methods book as well that's just maps the whole entire research, all of the different decisions throughout the research process, the different levels of engagement, and then it makes some suggestions on participatory approaches that you might want to consider at every phase and stage of the research process, depending on the level. And so what types of supports need to really be put in place to ensure inclusive engagement? Well, one thing we always talk about, but we won't get into today, but I'm always a huge proponent of both critical reflexive practice. So I always want to encourage researchers and patient partners and everyone who comes together to commit to ongoing critical reflexive practice. And what that means is really just looking at your own social location, how that might affect the way you're viewing a health issue that you're researching, how that might impact the interpersonal relationships that you form with others, and some of the assumptions that you might make about things, and really critically examine that over and over again to kind of make sure that you can understand systems of power and how that might play out in interactions and engagement. And also, we always have a big proponent of trauma-informed engagement. So really thinking through when you're developing your strategy and even your budget, what things need to be put in place to ensure that in no way any of your engagement makes anyone with lived and living experience feel powerlessness or re-traumatize in any way. And so those are some of the things that we talk about. But today we're going to talk about some of the key considerations in your budget that you want to start thinking about. First of all, we kind of bucket it into 3 or 5 categories. Sorry. First of all, recruitment strategy. So if you want to recruit a diversity of perspectives, you're going to have to think about how you're going to reach people. And that might not, so going beyond having a healthcare professional identifying some people with lived experience for your project, but thinking about those who may not have the same access. So maybe it's developing a relationship with a community group, attending some meals, bringing some food, doing different ways of building a relationship with different groups in order to be able to connect with people who might be interested in your project. So recruitment is one of those buckets to think about when you're building your engagement. Then, of course, we're going to get into a little bit more, but the time and energy, the experiential knowledge that people bring to the table is equivalent to all of that expertise around that people have around research or medicine, all of those things. So making sure that we are compensating people with lived and living experience for coming to the table with that knowledge, and also covering ahead of time out-of-pocket expense. So it's not an out-of-pocket expense. So trying to think about, having bus tickets on hand or having things ready to go before the engagement so that no one's out of pocket. Thinking about accessibility and safety, again, there's a lot of different ways in which you can pre-plan and budget for your engagement to make sure that you have assistive technologies, that you ensure that you have a space, and maybe you have to pay for that space that is accessible. And then thinking about the things that may help with safety as far as interpreters and different things that you might need when you're building your budget. That everyone has the capacity for involvement. So also just making sure that you're meeting people where they're at. I'm a huge proponent of meeting people where they're at versus having people with lived experience have to do a bunch of training to be engaged. So say if you're engaging youth and you want to talk about outcome measures that are really important to include in the research project, maybe you try something a little bit different, like have them take photos with their phone about outcomes that are really important to them and engage them in that way. So I'm a big proponent of art space and kind of meeting people where they're at. And that can be done in like data science, all of those different things. We've used storytelling and so on. So really thinking about what type of budget you want to develop that's going to have these inclusive participatory approaches. And then of course, key considerations around social and historical context of the engagement in which you are doing, and really have consideration around that and what it's going to take to build trusting relationships. And what that means is you might have to say if you have an advisory group and they're going to meet 5 times a year, you might want to add a 6th or 7th meeting to actually just concentrate on relationship building and trust building. So kind of making sure you add those pieces in to your budget ahead of time. So you have that flexibility to kind of have additional meetings. So budgeting, yay! So first of all, as I was talking about, there's compensation for the time and the energy and the expertise that people bring to the table. And there's different forms of payment, or there's different ways in which people can compensate. There is the fixed service income, and that's really where you have an hourly or a daily rate. Some of the SPOR working groups have made recommendations that we look at a minimum of $25 an hour. Some recommend higher. You can always take a look at your SPOR support unit and find out what they recommend. Because sometimes different provinces and territories have different recommendations. There's also the salary or stipend route. And that's where we definitely recommend you talk with your institution, because that involves a lot of, your HR and building kind of a classification and a salary. The honoraria, that's when it's kind of a one-time event. Those are typically the best times to use an honorarium, because say, for example, it's a one-time workshop where you're having people come together, you can have a nice set amount. And then the in-kind payment or gifts, this is when perhaps someone might opt out or decline payment, but really maybe there's something that could help them out in meeting their goals. So maybe it's paying for a course that your institution is offering, so paying the tuition for that course, or a conference or something that they would like, that you can help out in that way instead. The big things to consider is always making sure that you give information and opportunity to each individual patient partner to explore payment options for engagement. Uh, Contact your institutional finance and HR, really important part, because sometimes there can be some things that have to be done. Then also having conversations about the potential financial impact. So we know CRA gets involved if it's over $500, that you get a T4A, like you'll get a tax. It will impact your taxes, but also it can impact people's EI, their disability income. And so it's really important to have those conversations up front. And typically what we do is we have links to the CRA guidelines, but we also keep a list of free tax services in our area. So if people have additional questions that we can answer around the compensation piece, that there are free clinics around there. And then talking about different payment styles and amounts for members who face systemic barriers. So for example, we do some engagement sometimes where people are precariously housed, do not have a home address, do not have a bank account, different things like that. So we have to make considerations on how we're going to pay, and there may be different options. And then always discuss options on a one-on-one basis with people and not make assumptions or decide for them how they want to be paid. Transportation's a big one to always think about when you're budgeting. Things like having bus tickets on hand. If you're kind of doing a local engagement, taxi, we set up taxi chits where they can actually they can charge us back. So we have that connected and set up for them ahead of time. We have parking passes if there is parking, mileage, so paying people mileage. But then when you think about engaging rural and remote, thinking through everything that comes with that, right? That flight costs, hotel costs, luggage, always include the luggage with the flight. Don't expect your partner. That one sometimes becomes, so thinking about all of that, ferries, right, to get to a certain location, all of those transportation costs are really important to consider and work out as you're developing your strategy. Parking is a big one. We try to find places in community that do not charge for parking, but if you do engage somewhere that has parking, having parking passes on hand so no one has to pay out of pocket. So thinking that through, we typically ask people ahead of time just to get an understanding of how many people might need that, and so we have it on hand. Caregiving and respite, so people looking after children and need some babysitting for their children. It's really important to factor that in, but also those who are looking after older adults who might need caregiving assistance or respite so that they can fully and actively contribute to the engagement. And this includes engaging online. Sometimes we're like, oh, well, we're engaging online so they can have their kids running in the background, but it is helpful if you offer to have someone, a caregiver or a babysitter, come in and help out so that that person can be actively engaged and contribute fully without any barriers. Accommodations, important again. Really important thing that we learned over time is accessibility. Sometimes accommodations say they are accessible and they are not, or like a bathroom is not, and so we typically check out places ahead of time when we book. We even include a partner with lived and living experience of disability to kind of take a look around rooms and things, just to make sure that we are paying for the right accommodations for people. Food and beverages. We all have been at meetings when we're hangry, right? When we're so hungry and there's no food. I find what we hear from community the most is food is really an important aspect of engagement, because that's where so much of the relationship building occurs, is when we're eating food together. So always recommend either having healthy snacks when it's a smaller, shorter meeting, having some healthy snacks and beverages. But then if you're going for a little bit longer, have a meal, schedule like a half hour to an hour ahead of the meeting so that you can eat together. Um, and for those who are joining hybrid, you can tell them to come in afterwards. But we have also had conversations when you're doing online engagement. A lot of our community members are like, I miss eating together. Can we do skip the dishes? Can we kind of factor that in? And so we've had a few of those engagements where we've actually done skip, where we can all eat together, even though it's online, and have a half hour before the meeting starts just to talk about our lives and kind of engage in that way. Care attendants and caregivers. So really talking to people with lived and living experience about what's going to make their engagement the best for them. So it may be that you have a care attendant come or a caregiver come to help out, and really thinking about paying for their time as well. If they're coming, we also, from a trauma informed lens, sometimes just having a friend or a support person to come with you, especially if it's a really difficult conversation or talk around a health issue, making sure that the supports are in place. So maybe it's paying for food for the other person, or paying for accommodations for a person who's coming along with your member. Translation interpretation, super important. Always thinking about people who speak different languages. English is not their first language. We should try to get both translation for written materials and then interpretations, and having conversations with partners around that. What would help the most? And when we talk about interpretation, that also means sign language as well. So factoring that into your budget, so that your engagement can be inclusive. Technology is now that big since our pandemic, really thinking through who has access to technology, especially if you're engaging online. I remember during the pandemic where we could only engage online, we had to factor in that not everyone has uh, electronic devices to engage. Some people are engaging on their phone, but also doing things like connecting with community organizations to see if you can book a room with a computer that's close by to a patient partner that they can come and use for a couple hours. So figuring out ways. We've also paid for Microsoft for someone's computer who didn't have it because they couldn't open those materials. So really making sure that everyone's taken care of and can participate equally. And I think we talked a bit about accessibility. Again, really making sure that the spaces in which you engage are truly accessible, and looking through them and being willing to pay extra just to make sure that it's an accessible one. Nice. That's a great link there, Chelsea. Printing materials. Sometimes we have partners who want hard copies of things ahead of time. So we print out materials and mail out to those folks, but really never expecting people with lived and living experience to have to print out your materials. So having it printed out so that they can have it at the meeting, or if they want it in preparation before the meeting. We have partners who review award applications, and we print them out and mail them out, or drop them off and make sure that they have those hard copies that they can look through when they're reviewing. So thinking about that as well. Elders, counselors, and support's a really important one. When you're doing your external evaluation and talking to community, having that conversation, who needs to be at our engagement, and we want to make sure that we factor that into our budget as well. So a lot of times, With our Indigenous elders, there is a set rate and a fee, and making sure you know that and understand that and are ready in your budget. And gifts as well. An amazing researcher here, Amanda Fowler Woods, was talking just about the importance of giving gifts at the beginning of an engagement. So a gift of tobacco. So really talking to people and saying, how do I best engage and what do I need to factor in? So thinking about all of those little things when you're building your budget. Professional facilitators. So sometimes people feel more comfortable with hiring facilitators to do their engagement, or we have one project where a group has done all the relationship building and so on, but they have one research decision where researchers feel they might bias the conversation. And so they're bringing us in just to facilitate that one group. So really thinking through, do I need assistance from a facilitator, and should I factor that into my budget as well? Conferences and capacity building. Factor in your budget for engagement, having people with lived experience attend conferences if you're going to present. If there's capacity building opportunities, making sure you think about how much is that going to cost, what's the registration, and could we send some people with lived experience. And so our little budget building tool now will start helping you put this together. It's an Excel file, and it was co-developed with researchers, knowledge translation and patient engagement practitioners, as well as our community partners. And we continually update it based on user feedback. We got some recently, we're updating it again. It has a really cool summary table that's formatted for copy and paste into a grant proposal. So that's kind of neat. It gives you that one-stop shop. We do have a how-to blog as well, but we can take a look at it. I will just bring it up now. So I'll stop my, oops, now you get to see me looking at, here we go. Do we see the budget builder, Chelsea? Yes, excellent. So
Clear.
it doesn't look so fancy, but it definitely helps along the way. So what you'll notice first of all is at the bottom, we have 4 different tables. And so the budget builder, the first one here, we start going down, looking at some preliminary questions that will help you calculate estimates. Oh, I'm just going to bring up, oh, sorry. Now I've got to be able to actually scroll down. Sorry about this.
No problem. While you're working that out, I'll just let folks know if any of the text is small for you and you need to make it bigger, you'll notice that there's a zoom option at the top of where you can see Carolyn's shared screen. So you can do that and scroll on your own screen down to the spot that you need to look at.
There we go. I think this is going to work. Oh. Can I? Oh, now I can scroll. Oh, so there. Sorry. Okay. It is easy to use. I swear, it's just me today. So we go through some preliminary questions at the beginning. So this can just start helping you calculate your estimates. So number of meetings, how many meetings or gatherings do you intend to hold with patient and public partners? A lot of times when I'm just starting out, I think about how many decisions throughout the research process people with lived and living experience can be engaged. I typically try to do one decision per meeting because oftentimes you might want to use a participatory approach that actively involves them and it only can be done in one meeting. And then I build oftentimes I build some relationship building at the front and end. So say, for example, if you had 4 major decisions and input that people could do, and then you want to add 2 more meetings for relationship, we'll just add, oh, can I add something in there? So I would about 6 meetings, and then it asks you how the duration of meetings and how long in hours do you expect each meeting to last. So this is where you put, maybe 2 hours. And then how many people do you expect to attend? And it'll give you a calculation from there. Then when we start getting into compensation, there's a separate compensation budget builder here that's going to ask you whether you want a fixed service income. So that's where you would be talking about how many people would be receiving an hourly compensation and what is the rate of compensation. And it calculates it all out for you based on what you filled out on the previous budget. Honoraria. So this could be the one-time payment that you would calculate here. In-kind compensation. So there's some examples of different in-kind compensation that you might want to consider. How many people are we giving in-kind, and what type of estimate would you allot for each of that? And so then you go back and it'll calculate all of it out for you from there. And then you'll start talking about the engagement activity costs. So food and refreshments, you'll put in, we kind of did some approximations that have probably changed since then, but $5 to $7 for snacks, 12 to 15 for meals. And then you just put what the amount would be, and then it calculates for all the people and all the hours that are there. And then a professional facilitator, you can put in the hourly rate that the facilitator you're thinking about using, charges. Are there some support services? So this is where you would start thinking about elders, or sometimes we have social workers or counselors who we have attend, and you can also put in an hourly rate that they do. Interpreters or translators. This is another area, and this is where you can go to your inclusivity. We have a new template. This is our inclusivity and accessibility considerations. So it talks about how many interpreters or translators, what's the average hourly rate per, and so you can calculate that out. Then we can also look at childcare and caregiving costs. And so how many people in the meeting require childcare? What's the cost per hour for that childcare? And I'll calculate it for you. Caregiving and respite. So this is where you might have an older adult that requires you require some caregiving. And then costs for travel. And so thinking about how many meetings are people going to be traveling from rural and remote, and how many people will require airfare, travel expenses, and accommodations. So you'll think about the travel expenses required, how many nights of accommodation, what's the cost of an accessible accommodation for each patient or public partner, what's the average cost of airfare, bus, gas for each patient or public partner per meeting, how many meals will need to be covered for the duration of the patient partner's stay, what is the estimated cost per meal. So this is where we're getting into per diem. So not just providing meals at the meeting, but understanding this person's traveled from out of town. Are there travel companions that will come with them? What the estimated cost of travel companions as well. This one's a great one, and this one came from one of our partners. Do people need health insurance for travel purposes? So not everyone has access, not everyone has health insurance, and you sometimes have to pay for it if you're traveling. So calculating that into your costs and what is the estimated cost of the health insurance. And then when we think about also if we need a care attendant or a support worker for a few partners, what the cost per hour would be. Do we require any assistive devices to participate fully? So different technologies that might help. What is the cost per assistive device? So specialized software or hardware, thinking about that, and the total cost for accessible formats for the meeting materials too. So all of those pieces. And then you go back to your lovely budget builder again. And you've gone through all of that. And then meeting costs, you're really thinking about the venue, if you have to pay for it, audio visual, transcription, if you need to pay for that as well. Things like printing and materials, calculating that in. And then there's a piece for gifts. So really thinking about tobacco, different gifts that you might require. Any one-time costs. So this could be some of your recruitment materials that you're going to be using at the very beginning of your engagement. And then we always recommend a contingency fund because you never know what might happen, right? So between 5% to 20%, some people build some hefty contingency, but we're always thankful because we know things arise. Sometimes you need an extra meeting, any of those things. And then once you've filled out all of this, it will give you a nice copy and paste budget that calculates all of these pieces. And it's really good for funding and grant proposals and applications because it will show that you thought through all of these different aspects when you were developing your engagement strategy. So you built in all of these things and thought through what it's going to take to engage inclusively. So that is our lovely budget builder. And I'll just go back to my, I'm just double checking. Oh, I'm running out of time. I will just share this back. Share this one. Sorry. So just in kind of after you've done your lovely budget and so on, there's always also additional ways that you can show your appreciation for no cost, right? So things like offering skills building opportunities, having a dedicated workspace for people with lived and living experience. So having a place with a computer and a printer that they can come and print out their materials or check their emails. Co-authorship, co-development of presentations, helping people prepare and practice for presentations, involving partners in meetings with decision makers, regular updates on the impact, all of these things. We do certificates of appreciation, reference letters for people for work, school, other activities, nominating partners for awards or features on the news, documenting and sharing partner contributions and featuring partners, really helping support, showing up for community events sometimes if your partner is presenting somewhere or if there's a big community event around something that they're passionate about, showing up and just attending. All of that stuff is free and you can show your support and appreciation in those ways as well. And so there's some additional research resources, and I know Chelsea also included some great ones in the chat box. And so I can open it up to questions. Oops, are you on mute, Chelsea?
Oh, thank you. Thanks for that. I thought I clicked on mute, but I guess it didn't work. No, I was just saying thank you for this. It was so comprehensive and it's such a great tool. And it's been really interesting to see how it's evolved over time and all these new additions that you have. Because I think that traditionally in research, from a researcher perspective, when you're thinking about your budget, it's not that you kind of haven't, you've obviously thought about your proposal and your protocol a little bit, but you kind of expect the budget to be kind of cut and dry. But when we're talking about engagement in research and patient-oriented research, you really have to actually consider what your values about engagement are prior to creating your budget. And it's helpful to do that because we're all kind of bound to these university policies or healthcare policies or whatever institutional policies you're working within. And so if you have that if you do that critical reflexive practice beforehand, and you come up with your own values, then you have ways to kind of circumnavigate some of the institutional barriers that exist to some of these budget components. So it's really interesting. I have questions, but I see there's a question here in the chat, so let's address that one first. Kathy says, is there an estimated percentage of overall budget related to the grant? So I'm assuming that they're talking about what percentage of the overall grant budget is spent on patient and public engagement typically.
That's a super good question. It all depends on, I would say it all depends on the grant that someone's applying to. I know with like SPOR funded grants, those ones typically want to see a comprehensive and great engagement budget. And I feel like on the application, it will give you some suggestions on percentage around that as well. So I don't think there's any kind of set percentage per se. It all depends on the grant that you're applying to. There's others where engagement is not seen as the priority, but those big collaborative grants, of course, predominantly your budget will be on engagement.
Yeah, I'll add to that. You know, we're always looking for all these different pots of funding. They're not all going to be huge grants. You have to do what's realistic for you. And I think, Carolyn, you gave some really great options for lower cost or no cost ways to appreciate and honor that contribution that partners are making. But you can also look out for, there are grants specifically for engagement. And so I encourage everybody to look out for those. Here again, I've got all my Newfoundland examples handy, but I'm sure you've got some in Manitoba as well. But at Memorial, we have the Office of Public Engagement, for example. So they provide, small pots of money that they mean for you to use only on this engagement piece. Or our unit and I'll support, we have funding for things like that. So there are ways that you can supplement whatever other research grant funds you're using on your project to build up some money to do good, meaningful engagement, I think. Oh, I see there's another comment in the chat here from Genevieve. She says, even when a proposal is funded, CIHR will typically cut the budget, example, by 20%. How do you recommend we deal with such a situation?
Oh, yes, good old those cuts sometimes. That can be really difficult. I think some of the big ones is when you're doing your external assessment and having conversations with people, you can build a budget that's kind of your ultimate ideal engagement situation. But then if your funding does get cut, really having good conversations with community members and people with lived experience to say, okay, communicating out front that there is a possibility it could get cut, and really thinking about alternative ways to meet people where they're at and figure out ways to still be able to compensate people with lived experience, but maybe it is going to be less meetings or or a different participatory approach. Maybe instead of having a lot of meetings, you're going to have like a half-day workshop and try to get as much as possible done in that amount of time, just really thinking about it. But being open and honest from the very beginning when you're doing your external assessment with people with lived experience, saying ultimately, like, I really want to develop a comprehensive engagement strategy and have it meet everyone's needs. But there is always that problem with funding that it could get cut, and we can always talk together about what might be some alternatives.
Yeah, totally. And I think too, we're always encouraging people to engage early. So some of those partners might have been involved in creating that budget. So in those conversations when you're creating it, hopefully you're saying this might not even get funded at all, and coming up with some contingency plans for how you can still make some of your plans work with a lesser amount of money. Okay, so I see another question here from Maria. Great presentation. Wondering to what extent these budgeted items can or should be justified. For example, I feel a reviewer may feel that we should not cover childcare costs so a participant can engage in our research.
Yes, I think you can always make an argument, especially as we talk about equity, diversity, and inclusion, that to be truly inclusive, those types of things need to be considered, or else you're probably excluding a group of people who would be able to contribute if that was paid for. We've done that before where we've tried to write and kind of that will happen even at your institutional level. We've had times where we've been challenged on, oh, should you be paying those types of things? And there's lots of resources out there now that point to the importance of engagement, and some of those critical factors that need to be thought out. So really making that argument, you're trying to do an inclusive engagement. These are some of the aspects that have been recommended to be looked at, and that we feel very strongly would be an important aspect of our budget.
Yeah, I think, I mean, I totally agree. It's kind of difficult. You'll always come up against some of those, some of that pushback, I think, because of course that, you know, when we're talking about money, people are always trying to give you as little as they can in order for you to achieve those goals, I think. But as Carolyn said, there are a lot of resources out there, and use your local support unit as a resource. You know, we're used to having those kinds of conversations and providing that kind of knowledge sharing and education with institutional bodies about why this is important, why we need to consider all of these things that might seem tangential to them in the budget. And so, you know, they might already have had conversations with the people that you're trying to apply for funding to, and can kind of facilitate that that justification for you, I think. And you know, and we run up against it too. I mean, I'm support unit staff. I'm in the process of planning some engagement right now. I would really like to offer gift cards just as a quick thank you for the people that I'm going to be engaging with. And now the university here would like us to have ask for people's home addresses in order for them to receive their names and home addresses in order for them to receive their gift cards. And of course, you can understand from their perspective why that would be important, because they want to be able to make sure that funds are being used appropriately. But also, the group I'm engaging with is an Indigenous community. And so if we think about trauma-informed approaches to engagement, it's really not appropriate for me to ask them for their home address, and actually might be triggering for some of those folks that I'm engaging with. So, you know, you have to kind of be aware of all of that and have thought about all of that and come up with some alternatives. In my case, we're considering door prizes, for example, rather than gift cards. So
that's good. Yeah, that was a really good point, because I know even on our SPOR unit too, I get CC'd on emails a fair amount that are like a researcher going back and forth with finance or something like that, and just you can always approach your SPOR unit and just say, I might need some help in explaining this.
totally. Does anyone else have any other questions? Just trying to keep an eye on whether people have their hands up. I mean, I agree. There's an earlier comment that said it's an excellent tool, and I can't agree more. I've used it several times myself, and I appreciate its existence, and also always appreciate your reminders about being critically reflexive and trauma informed, because I think it's easy for us to not take the time to think about those things when we're beginning these kinds of relationships. So I think, along with being a really great session about budgeting, this has also been a really good reminder about how to do good relationship building, because so often we don't budget for that relationship building, and it is absolutely essential if you want to have a cohesive research team and you want your research to you know, be efficient in the end. Because if you have to keep coming back to that relationship building or what people's roles are, I think you end up getting a little lost in the weeds, and you end up taking longer than you meant to anyways.
Absolutely.
If there are no other questions, I'll just close by reminding you all that this session is recorded. We also do have or try to have monthly webinars on topics related to patient-oriented research. Our next one is actually on Thursday at the same time. So that one will be on communicating in plain language. If anyone's interested in that, you can just go to our events page. I'll put the link in the chat in a moment. And then we'll be having our research design series coming up, hopefully the end of April, beginning of May. And the focus this year will be on patient-initiated research, or Carolyn, I really liked the spectrum of engagement that you used that called it patient-directed research. So I thought that was a really good way to determine it. So hopefully hearing from some folks across the country about that. And just want to close to say thank you so much for doing this session. It's always a pleasure, and I'm always learning something whenever we chat. So I'm grateful.
Thank you so much for inviting me today.
And oh, of course, if anybody has any follow-up questions or they want to get in touch with either of us, I'll just put my email there in the chat, and you can reach out to me, and I'll facilitate that.
Great.
Okay.
Excellent. Thanks so much, everyone.
Have a great day.